Hey, y'all, Gary Humble with Tennessee Stands. Hey, many of you know now that Governor Bill Lee has officially called a special session set to commence on August 21st. Of course, in wake of the Covenant School shooting, dealing with gun violence. But why the messaging is that no one's doing anything about red flag laws, the governor's official proclamation does indeed, of the 18 points listed, include a call to deal specifically with red flag laws, with emergency orders of protection. Whether or not the General Assembly will pass anything like that remains to be seen. Nonetheless, the governor did indeed include that in his call. But there's a lot of other things that are in there, like some reorganization of our state and local courts having to do with mental health, I believe. DNA collection. If you're arrested for a felony, not convicted of a crime, but enhanced or enlarged scope of DNA collection, which I find interesting. But one thing I want to talk about today that I've reported on via Twitter and email, and of course I'm spreading this information as usual. You know, for the last 3 years, what Tennessee Stands does is we spread misinformation, which usually means it's things that they don't want you to hear or that they disagree with, right? So, and one of those pieces of information is this, and I'll take you to the website right here. In the governor's call for the special session, this was the press release. This is not the proclamation itself, but the governor's press release. And you can see point number 2 is what I want to hit on a little bit today. And it says, directs TennCare to seek a waiver from the federal government to allow federal matching funds for Medicaid to cover services for mental illness and substance use disorders at institutions of mental diseases. And what I reported when I wrote was that the special session is calling for an expansion. I use the word expand Medicare for mental illness. Oh, Gary, you're wrong. There's no more money coming in. Well, let me explain to you what I mean. Expand actually is a very good use of that word, because what they're doing is they're expanding the use of our Medicaid dollars. Right now, those Medicaid dollars cannot be used in such a way where folks are being treated for substance use disorders or for mental health disorders inside of a mental health facility. And so what the state of Tennessee in this special session is seeking to do is submit a waiver to CMS, to those who regulate Medicare and Medicaid federally, so that the state is now allowed to use that Medicaid money in such a way that it can now impact substance use disorders and mental health. So it's going to expand the use of Medicaid. It is going to introduce, for the first time in this particular way, the use of federal dollars, federal funds, injected into mental health. So what I want to show you now is, and look, seriously, buckle in, all right? And bear with me, because if you really want to understand what's being put in front of our legislators for this special session, you need to pay attention. But buckle in for the next 20 or 30 minutes, okay? I'm just giving you a fair warning. So let's go back to this website right here. I want to take you to, so what are these waivers exactly? So I'm going to take you back in a minute to a letter that was drafted by CMS in 2018. But essentially, the waivers in the governor's call for a special session include these 2 points right here. Payment exclusion for substance use disorders and payment exclusion for mental health treatment, which essentially would allow the state of Tennessee now to expend federal funds for the use of those types of treatments. You can see that so far, 35 states, and again, this is as of July 17th, 2023, so fairly current information. Right now, 35 states with 5 pending have adopted the substance use disorder treatment waiver, but only 11 states with 7 states pending have opted to use the mental health treatment exclusion, which we are about to do. And I'm going to go through why I believe this is incredibly dangerous. But as I highlight these 2 sections again, I think it's worth noting. So far, again, That doesn't mean that these states won't or that they're not pursuing these waivers. But currently, conservative states are mostly conservative states like Tennessee and Florida and Montana, except for the substance use disorder exclusion, South Dakota, North Dakota, Iowa, South Carolina. Those states so far, since 2018, since this was first offered by Medicaid, have not accepted those waivers into their states, and I believe with good reason, with great reason, actually. And so let's now go and look at what this CMS exclusion is. These waivers per CMS were first offered to the states in a letter dated November 13th, 2018. And I want to hit a few points about this and how these waivers point back to the 21st Century Cures Act, which was signed into law in 2016. We'll get there in a minute. But also directly connected to the Substance Abuse and Mental Health Services Administration. And I'll, in the future, from here on out, in this video, I'll call that SAMHSA. And so I want to go through a few of these connections. But here, before I really start diving in deep here, I want to lay the foundation of why we're having this discussion. Because let me be clear. Your governor is calling a special session of the General Assembly under the auspices of public safety, having to do with mental health, and really, he won't say the words, maybe he has or hasn't, but acknowledge the fact that we are doing this in the wake of the left's call to address gun violence because of the shooting we experienced just months ago. But in order to do that, in addressing mental health, which unfortunately, without really doing the investigative work, a lot of Republicans seem to be on board with, mental health, in my opinion, is a Trojan horse. Mental health is a way for government to get more tentacles of control over the people, and they do that by federal funding, just like we went through in COVID, in the name of public safety, where you and I go through the process of giving up just a little bit more of our rights, just a little bit more of our privacy, so that we can all feel safe, whether it be from disease or by the violence perpetrated by other people, because we all know that government does a great job at fixing all of those things. And so in order to do that, to mitigate the mental health crisis we have now, Governor Bill Lee is going to sign a waiver, or petition the legislature to sign a waiver, which will now introduce federal funding, which it hasn't in the past, in such a way that it brings substance use disorders and the treatment of mental health under the guidance of the federal government vis-a-vis CMS, Medicare, and Medicaid. Why do I think that's dangerous? Let's go back to 2021 and let me give you a quick example. You remember, maybe, that in October of 2021, the General Assembly called itself into a special session for only the third time in its history, doing so not by a call of the governor, but by the legislature itself, to address issues surrounding COVID, predominantly everyone that was losing their jobs across the state because they refused to take a shot as a condition of employment. And what we found, to our great disappointment, is that in that bill in the special session, while the state of Tennessee did enact a law that protected Tennesseans and their right to make their own medical decisions, they exempted federal contractors and healthcare workers who worked for healthcare facilities who received Medicare and Medicaid funding, which was almost all of them. Why did the state of Tennessee exempt those entities from being able to protect their employees from medical discrimination? Because of the risk of losing federal funding. So what the law said in 2021 now is because the federal government, per an executive order of Joe Biden, had mandated that federal contractors mandate the shot over their employers. And by virtue of the fact that CMS now had mandated, almost sounds like medicated, which they sort of do that too, mandated that healthcare institutions receiving Medicaid, Medicare funds mandate the shot to their employees as a condition of employment. that the state had to exempt them from state law because the state couldn't protect them because they would lose federal funding. So now, fast forward to 2023, and we never learn from our mistakes. We're going to now play the same game. We are going to now fix societal problems and mass violence by increasing the state's ability to treat mental health, but we're going to do that with federal funding, which means what? Set the tables here. Which means now or at any time in the future, right, when the federal government makes some stupid requirement that takes your liberty, the liberties of the people of Tennessee, and we lobby our legislature, and the Tennessee legislature comes in to pass law to protect the liberties, the individual liberties of people, of persons, they potentially won't be able to do that to protect individuals from federal overreach and intrusion. Why? Federal dollars. Which is why when I ran for state senate last year, if you came to one of my events in Williamson County, you heard me say like a broken record that one of my primary missions was to remove as much federal money from the state of Tennessee as we possibly could, because it's clear to me that every time we entertain the notion of adding federal dollars or the use of federal funds through any federally subsidized program here in the state, that the state of Tennessee loses its ability to regulate policies over its own citizens, and we become subject to the federal government. So let's go back and let me show you what that looks like in terms of this potential Medicaid waiver. So this Medicaid waiver was promulgated by the 21st Century Cures Act, which I will go back to in just a second. But I want to talk about the Substance Abuse and Mental Health Services Administration. And sorry, I keep rabbit trailing. Before I do that, let's read through some of these requirements of this waiver. Now, these are some statements. I am going to provide all of these documents to you, and we're going to send out an email. This will be on our website, including our Rumble channel at rumble.com/Tennessee Stands. You will have links to all of these documents that I'm showing you right now. But in the CMS document, listen to this. As highlighted in an informational bulletin jointly issued by CMS, SAMHSA, and the National Institute of Mental Health, the Coordinated Special Care Model is an evidence-based model of care designed to help identify and engage adolescents and adults with SMI, specifically psychosis, as soon as possible in treatment with specialized mental health providers and community mental health clinics. So that's sort of the basis that they're giving as to why they've promulgated these new exceptions. But here's some of the things they seek to do. Of course, grab onto this one right up front, right? Improving data sharing capabilities between schools, hospitals, primary care, criminal justice, and specialized mental health providers. So what does that tell you right up front? It should tell what's increased data sharing capabilities? Well, surveillance. You only have increased data sharing capabilities when you increase your data collection abilities, right? Because you've got to have the data to share, so they're increasing their data collection as well. This is state surveillance, and not only going between the state, like it lists schools, hospitals, primary care, criminal justice. It connects the whole thing, right? It connects healthcare to education, to the courts. So this is complete. This is creating a complete profile, not only in the state, but with a national database. And I love that they are just very upfront right here in this paragraph. Through the Office of Civil Rights, this HHS OCR, Office of Civil Rights guidance required by Section 11003 of the Cures Act, clarifies, listen to this, how the HIPAA privacy rule permits covered healthcare providers and other mental health treatment professionals to disclose information to a patient's family members, caregivers, and others, key phrase, to facilitate treatment and protect the health and safety of patients and others. So another little caveat here. This waiver and the way these funds are expended and the requirements and the data collection that CMS provides now over the folks who elect this kind of a waiver in these mental health treatment programs, you're losing your HIPAA rights. You are now also losing your HIPAA rights in such a way where your private and personal medical data can now be presented to other family members without your permission, other caregivers without your permission, and the key phrase, and others without your permission. And remember this phrase during COVID, for what purpose exactly? For the safety of patients and others, okay? And you know, we've heard this language before. But this money from this Medicare waiver does not stop at these programs. It includes going after children in our schools. Listen to this next paragraph. Furthermore, improving the availability of behavioral health screenings and mental health and SUD services in schools is a key strategy for identifying and engaging children with SED, which is severe emotional disturbance, by the way, in care sooner. Providing behavioral health services in school settings has been shown to improve access to care, increase early problem identification, and overcome a reticence to access care by providing services in a more mainstream and accessible setting. In other words, if we don't want patients to have to feel like they come to the crazy house to get mental health services, we'll just take it right into the school setting, which might be more accessible to them. All right, I want to point out a few more things before I move on from this document. This is a 37-page document, again, that will provide a link to you for you to download. But I want to point out a couple of these requirements that will be passed down to the states should states elect to use this federal funding. So here's a couple of comments that I think are of worth noting. FFP, which is the money, also will not be available through these SMI-SED demonstrations for services provided in treatment settings for individuals 21 years of age or younger if those settings do not meet CMS requirements to qualify for inpatient psychiatric services for individuals under the age of 21. And if you're reading that correctly, you'll understand that this money is available to treat minors and children under the age of 21 as long as the state does what? Follows the prescribed requirements of CMS. What are those? Federal regulations. And not just current federal regulations, but any future federal regulations that might be promulgated by CMS in order as to how to provide mental health care services, not just to adults, but to minors as well. Let's keep going. States participating in the SMI-SED demonstration opportunity will also be expected to commit to taking a number of actions to improve community-based mental health care, as Section 12003 of the Cures Act also directed CMS to address systems for providing community-based services for beneficiaries with SMI or SED. And again, SMI is mental illness for adults. SED essentially is mental illness for children, just so that you know what that nomenclature means. And just one more or a couple more things I want to point out. The establishment, so again, these are some milestones. These are requirements. Again, if Tennessee takes these federal dollars, here are just some stated requirements from CMS. Establishment of an oversight and auditing process that includes unannounced visits for ensuring participating psychiatric hospitals and residential treatment settings meet state licensure or certification requirements, as well as a national accrediting entities accreditation requirements. In other words, the federal government is going to come check up on you to make sure you're doing what we are requiring you to do for the money. Lastly, implementation of a state requirement that participating psychiatric hospitals and residential treatment settings screen, this is a big one. Screen enrollees for comorbid physical health conditions and SUDs, as substance use disorders, and demonstrate the capacity to address comorbid physical health conditions during short-term stays in these treatment settings. Let me paraphrase or interpret. A requirement of CMS under federal regulations of any state that receives this money to treat mental health must also prove to the federal government that those facilities will also be set up to treat certain comorbid physical health conditions like COVID, like some other future communicable disease like some other future pandemic, because we don't really know right now what those comorbid physical health conditions are. But it's worth noting that in order to receive funding to treat mental health from the federal government, the state must also agree to abide by the CMS federal rules to also treat certain physical conditions, physical health conditions. All right, so those are some statements from a CMS document that sort of begin to create the landscape for these Medicaid waivers from CMS in order to treat mental health and substance use disorders in a state, should they elect these waivers. But what I want to go back to now is, and this is where you really have to take a moment and be willing to back up and look at the broader picture. Because what these Medicaid waivers are all based in was the 21st Century Cures Act, which, get this, was signed in December of 2016 into law by then President Barack Obama. This was after the election. So this was after Trump had been elected, but right before he had officially taken office in January of 2017. So the Cures Act was one of the last and final official acts of the Obama presidency. And I want to take you to this news clipping from The Hill. And I find it, just for fodder here in Tennessee, I find it really interesting that this picture, while showing President Obama signing this Cures Act into law, who's standing right over his shoulder applauding these actions? None but former Tennessee U.S. Senator Lamar Alexander, which I find incredibly interesting. But one of the things about this Cure Act that you need to see, it's interesting that this article mentions that liberals like Bernie Sanders and Elizabeth Warren were against the bill because it expanded too much power for pharmaceutical companies, which you have to think to some degree, maybe they were right. But the fact is, many Democrats came on board because, again, remember, we're talking 2016, before COVID, the final act of the Obama administration. What did this act do? It put $4.8 billion new dollars over the course of the next 10 years for research for the National Institutes of Health, the NIH, led by none other than Anthony Fauci. Literally, right before COVID was set to hit, and the outgoing moves of these buffoons that were in the White House funded all of this research going into the NIH. Another thing that the Cures Act did was create a new position under HHS and now gave position to the Assistant Secretary for Mental Health and Substance Abuse, which under HHS is the person responsible for leading SAMHSA, the Substance Abuse and Mental Health Services Administration, which, as you saw earlier, is one of the regulatory agencies that sets the regulatory scheme and how to deal with mental health using the Medicaid dollars that Governor Bill Lee is seeking to come into the state of Tennessee. And so I thought, well, gosh, currently the Assistant Secretary for Mental Health and Substance Abuse is this woman named Dr. Miriam Delphin-Rittman. Well, who's Miriam Delphin-Rittman? And so, just going to take you through a few tweets. Well, wouldn't you know that the person responsible for mental health here in the United States and promulgating all of these rules that we now seem to want to adopt here in the state of Tennessee has to do with LGBT. So in one of their efforts as to offer substance abuse counseling and mental health counseling, they are expanding services to LGBT youth. I find that interesting. Miss Delphin-Rittman was also very excited about promoting Pride Month on the part of the department because we need now behavioral health equity. Okay, so we don't just need, equity is not just important in education, people, but behavioral health equity is also a very important thing. And of course, SAMHSA's commitment to supporting Pride by also supporting, which I find interesting words to corroborate with gay pride, but family, school, and community, and they want to ensure equitable access. Well, what does, if you keep going down the rabbit hole here, folks, what does experiencing pride as SAMHSA mean? Again, the organization which sets the regulations for these federal dollars through CMS. Well, of course, part of that includes making sure that we follow President Biden's 2022 executive order right here on advancing equality for lesbian, gay, bisexual, transgender, queer, intersex individuals, which also I will send you a link to in everything that we put out on this video, but which includes mental health practices and putting all of these LGBT initiatives in front of our schools, in front of our children and our schools, including disparities in our child welfare system. So you need to understand something here. This is all baked into the cake. So federal money. It's hilarious to me that in order to address gun violence, the Tennessee General Assembly is being called into a special session to address public safety and mental health. Now, unbeknownst to you, being tied to federal dollars and programs that we spend a good amount of time in our legislature on the other side of the coin refuting and passing laws against in our state, like the use of CRT in our schools, and the drag queen performances in front of children, and our bill that restricts medical facilities from mutilating minors for gender-affirming care. Nonetheless, now we're going to bring in funding for mental health services to fix gun violence in the state of Tennessee, all surrounded by federal restrictions and requirements, which include the promulgation of LGBT ideology, all the way down into our education system and our child welfare system. It's absolutely bonkers. But let me go back to this final point, and then I'll close, on the fact that all of this hinges back on this Cures Act, because now I want to take you to the 2016 Cures Act, again, which sets the regulatory scheme for the federal money that we are now asking to be spent in Tennessee in 2023 and moving forward for the purposes of mental health. By the way, this mental health portion, I find the portion of this article incredibly interesting, because this was the Republican response worked on primarily by Congressman Tim Murphy of Pennsylvania. By the way, he resigned subsequently less than a year later in 2017. Check this out.
The anti-abortion congressman who reportedly asked his lover to get an abortion will retire at the end of his term. Representative Tim Murphy announced he would not run for re-election in 2018 amid criticism over alleged text messages he sent to the woman he had an affair with.
And so, as Republicans across the nation continue to do, we trust men of incredible moral authority and aptitude to create these large, sweeping regulatory schemes over the people. And the Republicans entrusted Congressman Murphy, abortionist, to craft a plan to address gun violence by mental illness. Why? Because of the continued Republican mantra, well, we can't just do nothing. So this whole scheme around mental health and the section of this Cures Act bill that involves mental health, even back in 2016, was part of a larger plan that the Republicans were putting forward in lieu of gun restrictions to address mass shootings and gun violence in order to, quote unquote, do something by treating mental health. And so now let's take a look directly at the 21st Century Cures Act itself. And, again, this is a 312-page document that we'll make available to you, but I want to highlight some headlines from the table of contents from the Cures Act. Let's talk about COVID for a minute. Remember, This was 2016, just before COVID. The same bill dealing with mental health. Here are some of the headlines that this new law dealt with. It reduced administrative burden for researchers. Again, remember all the billions of dollars that went for research. It exempted the NIH from the Paperwork Reduction Act requirements, and it encouraged high-risk, high-reward research. It promulgated technical updates to a clinical trials database. Bear with me. It created novel, remember the fact that the coronavirus was a novel virus? It created novel clinical trial designs. It created alterations to an informed consent waiver or alteration for clinical investigations. I find that to be incredibly interesting. It created medical countermeasure guidelines, streamlining Project BioShield procurement, which, by the way, has to do with medical countermeasures in terms of things that may threaten national security, like COVID, like a public health emergency. The Paperwork Reduction Act waiver during a public health emergency, clarifying the FDA's emergency use authorization. Predictable view timelines of vaccines by the Advisory Committee on Immunization Practices, and encouraging vaccine innovation. I want to submit to you that all of these things, hear me, so we funded the NIH to the tune of $4.8 billion for research. We clarified the FDA's emergency use authorization protocols. We removed paperwork and clinical trial restrictions under the NIH and the FDA, especially when it came to clinical trials for novel diseases. And all of these things happened in an act signed by Obama just before he left the White House, and only 3 years before we were hit with COVID. May I just submit and suggest to you, to those who are unable to read between the lines, that they knew. And they were already setting the table and setting the foundation for what was to come. But here's what I find incredibly telling and incredibly interesting, because when you go back to the Cures Act, that's just the first half of it. When you look at sections 6001 through sections 17 to 1800, this all has to do with mental health. By the way, which was all brought to Congress by the Republicans as an opportunity to address gun violence. And so it forms the position of the Assistant Secretary for Mental Health and Substance Abuse. It goes on to develop research programs and prioritizing mental health needs and substance use disorder treatment. It goes on to provide for grants for all of these mental health treatments, promoting integration of primary and behavioral health care, suicide prevention, mental health awareness, training grants, on and on and on and on, grants for education, programs for children with an SED, with a serious emotional disturbance, which is, we talked a lot about that earlier in this video. That is the nomenclature used that ties all of this Medicaid funding per the waiver that we are now applying for, all of the reduction on your HIPAA rights concerning medical health. So all of this was put into play in 2016 by the Obama administration at the same time as they were funding the NIH and reducing regulatory burdens on the FDA for vaccine production in preparation for COVID. I find that personally, as I'm sure many of you do, to be quite astounding. The point that I want to leave you here, and what I really want to hit home, is we have a special session coming up that as I've previously stated, typically the usual mode of operation for a special session is that it happens within the course of days. So we're not talking about weeks or months of deliberation. We're talking about omnibus bills. We're talking about doing away with the normal process of debate and testimony and committee hearings. And we're talking about a very expedited process of lawmaking. Myself and many others would say that is not the place to have these kinds of discussions concerning topics of federal funding and complicated topics such as mass shootings, gun violence, and mental health. And look, let me just say this outright. I think anyone who believes that it's not the government that created the mental health crisis in the first place is crazy. You know, people did not just all of a sudden magically become mentally unstable. But when you go back to the Obama years and the Ferguson riots and then the George Floyd riots and BLM and burning all the cities down, the trans agenda, the LGBT agenda that has been coming after our children, the COVID pandemic, the government mandates, the lockdowns, people losing their jobs, people not being able to provide for their families. During those lockdowns, the increase in suicide rates, the increase in emotional disturbances in our children because of what we did to them in our schools with masking and isolation and all the craziness. Government caused this. And the fact that legislators can't step back and see that government caused this, and they caused it for what purpose? Well, so that they can give you money and a regulatory scheme to fix it, which does what? It introduces control. This has all been for control. They set the tables with COVID, and they're setting the tables again with mass shootings and mental health. And thankfully, to date, states like Tennessee and Texas and Florida and Iowa have not opted to bring these schemes into their states. But seeing what Tennessee is pondering right now, I suspect that they might. The call needs to be this to every legislator right now in the state of Tennessee: adjourn the special session as soon as it opens. So Governor Bill Lee calls a special session, fine. Show up and drop the gavel and adjourn. Do not entertain any of this nonsense that if you just go back and pay a little bit of attention and look at how all this stuff has come about, it's not just free money. It's not just free money to go treat mental health and then we can get past this. It's not going to work that way. It's federal dollars that's going to introduce a new level of government control, a new level of federal overreach, the potential for now future regulatory schemes from the federal government vis-a-vis CMS that's going to further impede on our liberties here in Tennessee with federal funding. This isn't fixing anything. And may I just submit that we can't fix this. We have an evil problem. We have a societal problem. And what I would urge the General Assembly, if they're going to spend any money at all, send it to Memphis and put law enforcement on the ground that's going to arrest people. Get a DA in Shelby County that's actually going to prosecute criminals and put them in jail. We have to put criminals in jail. That needs to happen. We are watching Memphis literally burn down. Is there a mental health crisis in Memphis? Probably, because people are scared to death. But it's not because they're going crazy because of some new disease or incredible cultural phenomenon. It's because people are killing people and nobody cares. And so those are the types of things that the state of Tennessee should be concerned about. We should punish criminals. But this idea that we're now going to entertain federal funding to address mental health, to fix these gun violence problems that we're seeing, nonsense. By the way, we still haven't seen the Nashville Shooters Manifesto, and I think we would all